of CareSouth Carolina come together for a day of fellowship and day of learning, training, and refreshment. And so we haven't done that since 2019 December, and we were able to do that this week. We split it over 2 days to try to be as safe as possible in this current environment. But we did it,
We did
and
it.
we did it,
We did
and
it.
I'm tired, and
I'm
thank
telling
God it's Friday.
That's right. We were able to have everybody tested prior to having these meetings, making sure everybody was negative. Also, we wore masks. We did the ones that didn't feel comfortable being in close proximity to each other. They were allowed to have social distancing according to color codes, and everything was honored. And everybody was really, really glad to see each other's faces as much as we can see. Right. Most of the time, we can
Absolutely.
only see the eyes and the ears, but we were glad to see those eyes and ears. So it was wonderful getting together. We learned a lot of information, and a lot of opportunity for us to just see how this went. So the next one come, it'll be a whole lot more successful than this one. So wonderful.
Absolutely. Absolutely. So we always say thank God it's Friday, and there's a reason why we say thank God it's Friday, because when the Friday comes, we got what? Another episode of the Care South Carolina Community Live podcast. Again,
Yes.
I am your host, Mark Calhoun. I am the Director of Social and Community Services, always with my partner in crime.
Yes, and I'm the co-host. I am Daniel Myers, director of MATSUD services for Care South Carolina. And as always, I'm glad to be here on Friday. I'm glad for the podcast, and I don't even care if we got liquid sunshine outside. Hey, thank God for the rain. Thank God for the rain. That's what I'm saying.
Absolutely.
Yeah.
So listen, we got a special podcast for you today. We have a very, very special guest with us today. In the past, as you know, we are a friend of the show, Dr. Jan Kelly. She has gone on and retired, and she is enjoying her retirement. Yeah, doing a little something else on the side. We had a chance to talk with her here a while back, but she's enjoying her retirement. But we got a dynamic gentleman here today to
Yes.
to talk about COVID. You know, we always get our COVID updates. We're going to talk COVID. We're going to talk the vaccine, and we're going to talk about those monkeypox. We have
Yeah.
a dynamic speaker today and dynamic guest.
Yes.
Um, and we're going to let him come up here and tell us a little bit about himself. We have Dr. Knoche from DHEC. So, Doc, we're going to move out your way, and we're going to slide this way
Yeah.
and that way
Yeah.
and let you have the floor.
That's
Appreciate
right.
it. Thank you, guys. So yes, I'm Dr. Jonathan Knoche. I work for DHEC. I am board certified in pediatrics, but I work primarily in the public health setting. Now I've been at DHEC for about 3.5 years. I worked with the greatly esteemed and famous Dr. Kelly before she went into retirement. She actually came out of retirement to help us here at DHEC before going back into retirement. So I'm honored to be kind of back in her shoes, I guess, so to speak, and be here with you all today and talk a little bit about COVID-19 and any other questions you guys might have.
Absolutely, absolutely. So let's start this way. Let's start this way, Doc. Could you kind of give us an idea of where we at as far as state of South Carolina with the current state of COVID? Are there any new variants out there that we need to worry about, or are we still dealing with Omicron and maybe Delta?
Yeah, the predominant strains that we're seeing across the country and in South Carolina are Omicron and its subvariants. So predominantly BA5 and BA4. Those are kind of the two major ones. There's another one that's sort of lurking out that people are interested in, and that's BA2. 0.75. So we'll see what happens with that one. But the predominant strains right now that are circulating most are Omicron subvariants in South Carolina.
Okay. So for those who may be looking for the first time or looking to get some information they hadn't heard in a while, tell us a little bit about Omicron and what made it different from maybe Delta or BA1, the original uh, um, variant of
Sure.
yeah.
Yeah. Yeah. Good question. So viruses like to mutate. It's what they do as they replicate and reproduce. They make different capsules that go around its genetic material. They have different proteins that stick out of their capsule that are able to bind to the body. And just as the virus divides and replicates, there are little errors that happen in its replication. and those errors become mutations. And some of them are to their advantage. It gives the viruses a competitive advantage in causing infections. So as time goes on, it's not surprising that we have had different COVID-19 variants. And right now, the one that's circulating the most is the Omicron variant. And so there have been different changes in some of the proteins that make up the spike protein of the subvariant that allows it to infect a little bit more easily than some of the other variants of COVID-19. And it spreads more easily, but it doesn't necessarily, on a population level, cause more severe illness. But if you look at any individual patient, they might have a worse illness from the Omicron variant than they maybe would have had from a previous one. And just by sheer number, if you have a variant that infects people more easily, even if on average it's less severe, if it's infecting a lot more people, you might wind up with just more numbers of severe disease and hospitalization. So right now in South Carolina, for example, we've had about a 12% increase in the number of hospitalizations on average compared to the previous 4 weeks, even though the number of cases has gone down about 20% compared to the last 4 weeks. And part of that's a testing issue, right? People don't have to go to a provider to get tested. And if you do go to a provider or go to a lab, those get reported to DHEC by law. But there's a lot more at-home testing going on. So people are swabbing themselves and they get the result and it doesn't get reported to DHEC because it's not required to by law. So even if we look at numbers and tests that look like they're going down, we can sometimes look at the number of hospitalizations that are occurring or the number of deaths that are occurring to kind of give us another picture or a better picture of what's going on in South Carolina.
Doc, what about interventions? Are there any new interventions or any new things out in the air or that's going on that might be able to assist us and help us through this part that we're going through right now with COVID?
Well, I think I would say two things to that. One is the vaccines are still available, and a lot of people in South Carolina have not been vaccinated, in particular the kids. So if you look at our website, we follow and report the number of people that have started and completed their vaccines for COVID-19. So if you look at, for example, the adult population, 12 and older, about 60% of people 12 and older have completed their primary COVID-19 vaccine series. So 40% have not. If you look at kids age 5 to 11, more than 80% have not completed their vaccine. So less than 20% of kids age 5 to 11 have completed their COVID-19 vaccine series. That's pretty significant. And, kids are going back to school now, and there's that risk where there's not requirements anymore for distancing, mask wearing. That as you have a variant that's able to spread more easily, it will infect more children, and that will keep them out of school. And that's obviously not what any of us want. So that's why we're still recommending that people get vaccinated. We've got more vaccines available through the course of the summer. We've had Pfizer and Moderna approved for kids under the age of 5 as well. So that's just starting to ramp up and get underway. But the kids that are 5 to 11 have been available for some time. And if kids get their vaccine, they get to stay in school. And it prevents them from getting serious infections, winding up in the hospital or passing away. We've had at least 20 kids die of COVID-19, which is pretty significant. On any average year, we might have one kid die of flu, but we're talking about a significant number more than that for COVID-19. So that's the first thing I would say. COVID-19 vaccines, they're effective, they're safe, they prevent hospitalizations and death. Even if somebody does get sick with COVID after they've been vaccinated, their illness will be more mild than if they hadn't been. So that's thing one. The second thing is that there is a new variant specific vaccine that's being worked on for the fall. The FDA and at the federal level, they've been requesting that manufacturers create a booster that includes a target for these Omicron variants. So that's something that we expect to come out later this fall. So that will hopefully provide a little extra protection for the variant we see circulating right now. Obviously, as I've mentioned, that's subject to change because these viruses, these variants continue to mutate. It's just what they do. So, hopefully that will happen. And even more broadly, I know I was reading, I don't have any insider information. I was just reading the news yesterday that over $200 million have been put into research and development for manufacturers to look at vaccine that will help target all the different variants, but also coronaviruses that just cause the common cold. So before there was COVID-19 coronavirus, there were also just 4 major strains of coronavirus that cause a common cold. And so I know Moderna has thrown its hat into the ring to start looking at providing a vaccine that targets not just COVID-19, but other just general coronaviruses. So I think we're going to see more to come on that in the years ahead.
Okay. Well, and I got one more question, Marek, if you don't mind. I've been hearing a lot of talk about people who've been tested positive, and then they get over it, and then all of a sudden they test them positive again, maybe a week or 2 later. Why is that happening now? Because before it was like once you test positive, you catch it and you go through the cycle of the virus, then it's a while before you can be reinfected. But now it's like happening back to back. We even see it on the news with some of our government leaders. So can you explain that for us?
Yeah, so I think there's probably a couple of things at least that might be going on with what you're describing. I think one is that people that have been infected with COVID-19, probably an Omicron variant like BA4, BA5, they're getting treatment with Paxlovid, and their symptoms are getting better. And then after they complete their course, they're having rebound symptoms. So the treatment course might have helped suppress things, and then as they complete their treatment course, for at least a proportion of them, not the majority, but some of them, they will wind up having symptoms come back after they complete their course, and they kind of have a rebound, so to speak, of symptoms and potentially positive tests.
Okay.
So, and the other thing I would mention, just with the different subvariants of these variants, Omicron in particular, that we're seeing, is also changed. Has led to a change in recommendations about at-home testing from the FDA. So last week they put out recommendations that if you do an at-home test and you get a negative test result, you should go ahead and repeat that probably a couple of days later, just to make sure that the test maybe didn't give you a false positive, that maybe there was some subvariant that was kind of evading a little bit. But if you do it twice, that chance of missing it goes down. So there's a recommendation that if you have a at-home test and you think you have symptoms, test one day and then do it again a couple of days later. So I did that for myself last week. I had a little bit of a runny nose and a sore throat and some aches. And so I did a test on Wednesday, and I did it again on Friday, and both of my tests were negative. So that's just a little change that came out from the FDA last week.
And so I know this is allergy season, right? This is allergy season, and people out cutting grass and people hanging out more. They doing more things outside. So it's easy to be confused with the allergy symptoms and the COVID symptoms. Is there anything in particular that should be a red flag that I might need to be tested, or should we just be testing anyway because of those symptoms?
Well, there's some differences, I would say, from seasonal allergies. I think most people that have seasonal allergies will have a runny nose and maybe watery eyes or itchy eyes, but you usually won't have muscle aches or a fever or some other general symptoms that go along with that. So I think if you think it's your seasonal allergies, take your allergy medication. If you feel like it's getting it better, well, then there you go. It was your seasonal allergies like you expected. But if you have any other symptoms, fever, headache, muscle aches, change in taste or smell, that would be more concerning for something like COVID. And you should go ahead and test yourself or go get tested.
Okay.
Good question. That's
So we had a question to come in. It says, if someone is not vaccinated, do they have to get all 4 current COVID vaccinations before the new Omicron variant vaccine can be taken?
Well, we're still waiting I don't believe so, but we're still waiting for official guidance about that when it comes out. I expect that we'll see the advisory committee on immunization practices take a look and just see if they need to make any changes to their recommendations. But I don't suspect so. I think they'll probably be able to get it straight off the bat as part of the routine vaccine series, but we'll have to wait and see what the official recommendation is.
Okay, so just for everybody that's watching, if you got any questions, now is the time to go ahead and post those questions, so we have an expert here who can answer those questions and give us some some validity to the answers that we're getting. So please just go in the comment section and please post those questions. Me and Marek might not be able to answer whenever you give us a call. You might not want to hear our answers no way. So talk to the expert why he's here. So
absolutely.
Yeah. So
So let me ask you the conversation we was having earlier about the vaccines and the children. Do you anticipate, or are there any discussion on either state, national, or local level in terms of maybe in the future making the vaccine kind of sort of like the current required vaccines that the kids are taking for school?
Not at this time. There's been some discussion about whether or not there'll be a combined flu and COVID vaccine, but neither COVID nor flu is a required school vaccine at this time.
Right. Okay, so any recommendations or any, while we on COVID, any recommendations or any advice that you can give people as far as, I mean, any CDC regulations or any DHEC regulations or guidance that might help us stay safe during this time outside of vaccines?
Yeah, I mean, most people aren't going on the CDC website to look at how bad things are in their community, but there is a tracker from the CDC that looks at whether or not communities or counties have high, medium, or low activity levels of COVID. And when activity levels are high, which a lot of them are right now, actually, in South Carolina, across the country, that's where people need to start thinking about putting their face mask back on when they're in, enclosed environments. So for example, if I go to the grocery store, I put my face mask on. I had a meeting downtown today where I was in an enclosed room with folks I didn't know. So I just put my face mask back on as well. But it's not a requirement, obviously. I think there's a recognition that COVID-19 coronavirus is going to be circulating in the community at some low level for at least the foreseeable future. We don't know exactly what's going to happen long term. And I think people are trying to get to some level of normalcy again, which I get. But you really have very little to lose by putting a face mask on when you're in enclosed environments. I mean, it's a simple thing to do, but it protects you, it protects the people around you. And I think, some people just feel more comfortable doing that. And I think that's fine, but I think people have options that they can do these things and, put their mask on and make sure. I think that other major thing is make sure you're up to date on your vaccines. So I think those two things can go a long way.
Okay.
Absolutely. Could you and so let's pivot a little bit, and we're still gonna stay on COVID just a couple more minutes. Could you talk about Paxlovid and some of the other drugs? I know we've talked in the past about monoclonal antibody. We do a heavy number of that over here at CareSouth, South Carolina. But what about the oral medications? Could you kind of give us an idea of what they are and how they work?
Sure, I can tell you a little bit about them. I think, as you mentioned, there are kind of two major prongs. One is an antiviral treatment, so that's a medication that you would take, like Paxlovid. It's going to try and counteract the ability of the virus to replicate. And then the other major option is a monoclonal antibody. So that's essentially putting antibodies right into your bloodstream to help fight against the virus. As your body responds, it makes its own antibodies and can fight an infection. But by getting monoclonal antibodies or passive antibody, that allows your body to fight the infection until your body can mount its own response. I don't know how much more to go into beyond that. I think if people have questions or concerns, if they've developed COVID-19, they should talk to their provider about what might be an option for them. Paxlovid was authorized by the FDA for emergency use for mild to moderate COVID-19 symptoms for people that are 12 and older, so not everybody can get it. And so that would be, an option for folks that they could talk to the healthcare provider about and say, I'm interested in potentially taking this medication and work with their provider about that.
Well, I think this is a good opportunity. I think that's good information. I think this is a good opportunity for us to give a shout out to our CEO, Miss Ann Lewis, for caring enough about us and our community to have John Douglas to do a weekly COVID Digest update to let us know where the hot areas are, what our risk factors are, what each county in our service area is doing as far as COVID, how many people we got hospitalized. This report we get every week. And I think this is good information for us because it comes from a caring heart that she cares enough about us to keep us informed. And I think if people haven't been looking at it, they may need to, because it can kind of control their activities around what they're going to do around how extreme or how mild the cases are in our service areas. So I think kudos and shout out to them for that.
Absolutely. Absolutely. So if we could kind of pivot, because I think a lot of folks were, this is a part of the podcast that they really wanted to clue in on and have this discussion about monkeypox, right? What is it? That's what I want to know. What is it?
Yeah.
Sure.
What is it?
So monkeypox it's an orthopox virus. So it's in the same family as smallpox, but not a severe smallpox. It's not the same kind of pox virus that is in the chickenpox family, because I've had people say, "Oh, I've had chickenpox, or I had a chickenpox vaccine. Am I okay? Am I covered?" And the answer is no. It's a different kind of pox that we're talking about. It's been around before it caused the current worldwide outbreak that we're seeing. It was in Central and West Africa, and generally there was very limited person-to-person transmission. And the virus essentially causes a skin rash. It can be pretty painful, and it's spread mainly by close skin-to-skin contact for long periods of time. So its main mechanism of transmission is not through coughing or respiratory droplets. That can occur, but we're just not really seeing that. It can also occur potentially if somebody had their rash on some object. Let's say they're laying in their bed sheets and somebody else then is laying in their bed sheets after that for a long period of time. That's also a potential mechanism of spread, but we're not really seeing that either. And it's mostly spread from direct contact with the monkeypox rash to somebody else, and it's usually happens over a long period of time. People start to feel, after maybe a week or so, kind of run down, headache, fever, malaise, just don't feel well. And then pretty much everybody then gets a rash a couple of days later. And that rash can be kind of itchy sometimes. It's what's described as deep-seated. So it's not just superficial on the surface. You can the patients can feel it or sense it more deeply on their skin. And it goes through a period where first it's just kind of a red bump, and then it's a raised red bump, and then it's a fluid-filled bump, and then it becomes a pus-filled bump. And that pus-filled bump then in the middle gets a little dot. It looks almost like a belly button. And then that can ulcerate. And again, these can be painful. And it takes about 2 weeks to 4 weeks for that rash to heal and for the rash to fall off and new skin to form underneath. And people are able to spread that virus until that new skin forms. So it can be infected for quite some time.
And how long can that virus last on surfaces? Because I've heard it. It kind of frightened me when I heard how long it can possibly last on surfaces and be still contagious.
Yeah, I had somebody ask me that question the other day, and there was people that were concerned about, well, if I'm going to the bathroom at a public restroom, am I in danger of getting monkeypox on it, from a toilet seat or something like that? And the answer is no. We have not seen that. That's not its primary mechanism of action. But we recommend just routine cleaning. There isn't anything special people need to do as far as a special chemical in these settings, that if people are out, at a hospital or their janitorial staff's just cleaning, just regular cleaners are sufficient. But we're not seeing that, people are touching doorknobs or sitting on a toilet seat, or for example, and then getting monkeypox. It's really that very prolonged, intimate, close skin-to-skin contact that's causing the spread.
Okay. I know there was a big scare around here with people afraid to go and get gas because it was saying that you can pick it up from the gas pumps, and you can pick it up from pushing the buttons on the ATM cards, ATM machines, ATMs. I hate to say ATM machines. I'm repeating myself with that, but ATMs and just simple stuff. And people were really scared to do anything, so they was figuring they have to walk around with a hazmat suit on with gloves and a hood and everything else, duct tape, mosquito net,
Exactly,
or whatever. So what type of PPE or what should we be doing different now than before monkeypox? What should we be doing?
Yeah, the risk to the general public is really low. People should just continue to go about their everyday lives. There isn't anything that I'm doing to change my habits or that I'm recommending my family to do differently with their habits. We are, trying to be mindful about messaging sensitively but accurate information to folks to say, hey, if you're sexually active or being in close contact with somebody that's new, you can ask them if they have a new rash or look them over and see if they have a new rash. Monkeypox is not a sexually transmitted infection, but as I said, long, intimate skin-to-skin contact is a way that this spreads. So that happens sometimes during sexual activity, right? So that's something that it's not because of the sexual activity. It's just that people have close skin-to-skin contact during that activity, and that's how it gets spread sometimes. So we're trying to be mindful about being accurate in that information to let folks know that this is how it's really spreading.
And so you said when it gets to the pustule stage, is it contagious because of the fluid that comes out the pustules, or could it just be a person's infected and their skin touch your skin with no opening? So the skin have to be open, or do it have to be?
It doesn't have to be open. Yeah, that's a good question. It doesn't have to be open, but if there's somebody that does have, a break in their skin or an abrasion on their skin, that can increase the ease of transmission, certainly, but it's not a requirement for transmission. So right now we do have vaccine in South Carolina for people that are highest risk for monkeypox, or Mpox, we're also calling it. And so that's available in select health departments in the state. And the group right now that we're vaccinating, because most of the cases right now are occurring in men who are having sex with other men. And they may be bisexual as well, or, so it's not exclusively in men. We're seeing it in some women as well. But the groups that we're mostly focused on targeting right now who are at greatest risk are men who are having sex with men and have maybe had multiple sex partners in the last few months, or an STD, as well as anyone who's on HIV PrEP medication. And we're looking at potentially expanding that criteria in the coming weeks as well. But right now, that's the biggest risk group. It doesn't have anything to do with their identity or their sexual identity. It has to do with that, activity, the sexual activity and close skin-to-skin contact that I mentioned. But if there are folks that are, listening that fit that category, they could get vaccinated through a DHEC clinic. I think right now we've provided over 600 vaccines already. And so they can call the South Carolina the DHEC care line, and that's 855-4-SCDHEC, 855-472-3432, Monday to Friday, 8 to 6, and they can get an appointment to get vaccinated. We're also looking at expanding access for vaccines outside of DHEC to work with some private providers all across the state where people might be getting treatment already. So that's something that we're working on and will probably be coming in the coming weeks as well. So just to make access a little bit easier for folks where they can go to their providers they're already seeing, they already trust, and not have to worry about privacy issues or travel issues and things like that.
Okay. So I have one last question that I turn over to Rick. So people are scared right now because they hear it on the news that there's a shortage of the monkeypox vaccine. Is there a shortage? Is the first part of the question. The second part of the question, I think you already asked, is there any prophylactic vaccines or injections that we can take during this time?
Yes. So I would say nationally, there have been issues with, excuse me, with vaccine supply. I think in New York in particular, they struggled. In South Carolina, we haven't had that same challenge. We did receive additional shipments of vaccine in the last week. So we're able to replenish our supplies to the different regional health departments. So they're able to meet the demand and meet their appointments. So we haven't had that problem here in South Carolina, thank God, so far. But beyond the vaccine to prevent monkeypox, there is also a treatment. There's a medication called TPOXX that's available for people that get monkeypox as well, and that can really help to reduce their symptoms and some of the pain and things that they're experiencing. And we're working on improving that process. We've been able to distribute it to some clients in South Carolina already. but we're working to expand the ease of access to different pharmacies that are pre-positioned across the state. But there hasn't been a limitation on that medication as far as supply goes at this point either.
I know that CareSouth does well with serving the community whenever it comes to the pandemic and any of the epidemics that we're facing. So I hope I'm not overstepping my bounds, but if you guys are taking names and got some favors in there, you probably can send some of those things over to us, and we'd be more than glad to share with the people in our service area. So that's CareSouth Carolina.
Absolutely.
That's us. So if you want to
There you
send
go.
that over to us, we'd be more than glad to use those products to help the people in our community that do have those issues that we are serving. So yeah.
No,
That's
that's
just a
great.
few.
And that's what we need. We really need to be working with our community partners that have those trusted relationships. I think there's been a lot of, not to get into this very much, but I think there's been some, damage in terms of trust of a government, agency after COVID, right? I think people just you hear DHEC and you think, big agency you don't know. And really it's like, well, it's just me. I'm just a guy who's got a family and a doctor and want to take care of not patients in a clinic, but patients across the entire state of South Carolina. And our goal is just to keep people healthy. But we recognize that people have established relationships outside of DHEC with providers that they trust. And so it's important to have those partnerships.
Wonderful. Wonderful.
Absolutely. Absolutely. Wow. This is some great information. That was some great information imparted into us. We definitely appreciate you sharing that information with us. I don't see any other questions. You have anything else, Daniel?
No, I appreciate this. It kind of eased me a little bit. So having this information from you, knowing it's coming from an expert, kind of eased me a little bit, but it also allowed me to stay vigilant about my activities and about my going ins and going outs when it comes to both of these health issues, health crises that we're dealing with. So I appreciate your time and I appreciate your knowledge and sharing that with us.
Absolutely. Absolutely.
Thank you for having me, give me the opportunity. I appreciate a chance to share and connect with you guys and with the audience.
Well, as my grandma used to say, we family now. So
Yeah.
you'll be hearing from us again. We're probably getting you back on to share some time with us. That's right.
Absolutely. Absolutely. And before we close out, one last question: if someone suspects themselves of having or contracting monkeypox, what should they do?
They should contact their provider and let them know. There are different labs that they can be tested at, but the provider would be the one that has to collect the swab. So any lesions they have would be swabbed. They do an evaluation for other things as well, make sure if they have a rash, it's not something else or other reasons to have a rash besides monkeypox. And common things are common. So they should go see the provider, and we've provided information to doctors and providers across the state about monkeypox. We have information on our website, both for the general public as well as providers about monkeypox. Testing it can go to a private lab and go to the public health lab here in South Carolina. And, we'll get a result probably, anywhere from 2 to 5 days, depending on which lab you're using, and then give people some peace of mind about what's going on with them and their health. But once people can get tested, that gives, some guidance then about what they need to do as far as protecting themselves, protecting their family, protecting their community, and not potentially spreading the illness further. But the first thing is to first be seen and get evaluated.
All right. Well, before we get going, here's another question: what safety measures should we be taking by the provider and their staff?
So right now, the recommendation, if somebody's coming to the office to be evaluated for monkeypox, the appropriate PPE should be worn. So that would be eye protection, face mask, gloves, and gown. And a regular surgical mask would be just fine for that. We've not seen, there are over, I think we're around 14,000 cases in the United States. We have the most cases of anywhere in the world right now. But no, I don't think there's been any documented case, as far as I'm aware of, with at least being up to date within the last day or two, that have been transmitted from a patient to a provider. Again, it's being in close contact with that rash for long periods of time. So that's just generally not happening in a clinical setting or healthcare setting. And providers are usually wearing, appropriate protection to make sure they're not getting whatever thing might be causing the rash. It could be monkeypox, it could be something else. but we're not really seeing that healthcare workers are contracting monkeypox from seeing somebody in their clinic and providing evaluative care. So face mask, eye protection, gloves, and gown.
All right. Thank you so much. Definitely make sure if you suspect yourself of having it, reach out to your medical provider and not your cousin who graduated from the Google School of Medicine.
That's right.
Absolutely. Absolutely. And again,
a lot of experts like that lately.
Yes.
I know, right? And so, listen, there's one last question. We had done this question a long time, but we bring it back from time to time. Very, very important question we like to ask our guests. So we want to know, the world want to know, what does Dr. Knoche do when he's not being Dr. Knoche?
Oh, that's a nice question. That's an easy one. Well, I've got 3 little kids that are 7, 4, and our 1-year-old just turned 1 a week ago. So they keep me on my toes. So we're at the park playing soccer or taekwondo or at the beach or going swimming. So usually it's just family time, hanging out with my wife and kids, doing stuff around the house in the garden.
Absolutely.
You know what?
Absolutely.
Those are high energy ages, real high energy. So have you invested in Red Bull and caffeine, and have you invested?
Oddly enough, I'm not much of a coffee drinker or a caffeine consumer. You think I would be, but I made it through medical residency without really becoming a coffee drinker. But
wow.
Residents, everyone shows up with coffee to make it through the day, but I just never been a big coffee fan. But I just crash at the end of the day.
Absolutely.
Yeah,
absolutely.
That's the best sleep ever. That's the best sleep when they run you down. So that's the best sleep ever.
Yeah, they're good kids. They're good kids.
Absolutely. So listen, Doc, thank you for joining us today. Thank you for imparting wisdom and information on us. This is what we needed. We haven't had a COVID an update in a while, and especially with with monkeypox. Folks are asking questions. They're wondering, and so this was the perfect time to get you on. And we appreciate you coming on. Like Daniel said, your family now. So we don't want you to be a stranger. We want you to be able to come back anytime you want to, and certainly we'll definitely reach out to you, and if it's for a time convenient for you to give us some updates every now and then. But if you got something that you want to put out there, your family now, feel free to reach out to us. You always have a platform here.
And we'd never charge you $20. We would never charge you $20. So
I won't charge you $20 either, so we'll call it even.
We good.
All right, sounds good. So listen, Doc, if you could just hang around once we end, and then we're gonna go from there. All right.
Awesome. Thanks, guys.
All right. So listen, if you want to get in contact with Dr. Knoche and any of the professionals here over at DHEC, could you give that web address real quick?
SCDHEC.gov. And if you're interested in getting an appointment for potential monkeypox vaccine, you can call our care line as well. And that's 855. Oh, sorry, I'm going to get that number wrong. What was it? I got to look it back up. I had it. I forgot it. I'll get you. Hang on.
You got it. Take time.
For SCDHEC.
Absolutely.
Okay.
All right, sounds good. And if you want any more information about Care South Carolina, you can reach us on our website at www.caresouth-carolina.com. Check us out on our Facebook page, like and follow us at Care South Carolina at Facebook.com, of course. And you can follow us on Twitter as well as Instagram and our YouTube page at CareSouthCarolina.com, or give us a call at 866-498-0399. And ladies and gentlemen, we appreciate you coming on. We appreciate Dr. Knoche for joining us today. And this is the CareSouth Community Live Podcast.